Did you know that your pee might be warning you about an infection? And if you don't listen to these warning signs, you could end up with a pretty serious infection in your bloodstream. So, what are UTIs? Urinary tract infections, or UTIs, are infections anywhere in the system that handles your urine and flushes it out. UTIs can lead to more serious infections like sepsis or bacteremia, which are widespread infections in your bloodstream. UTIs can also cause permanent kidney damage if they aren't treated early on in the infection. Hi, I'm Dr. Sam. I'm a family medicine physician with the goal of helping you understand and take charge of your health one small step at a time. Today, we're talking about 6 signs and symptoms that show that you might have a UTI. Stick around to tip number 6, which most people don't realize can be a sign of a very serious form of a UTI. Let's start with the first sign of a UTI. The first sign is called dysuria, and this means a burning pain or a discomfort when you urinate. Some people feel this throughout the whole time they're emptying their bladder, but others feel this pain just at the very end of their urine stream. This pain is because of the irritation that happens to the bladder and the urethra during the infection process. Let's draw the urinary tract to get a better idea. Here are your 2 kidneys. Kidneys are the filtration system for the body. When you drink fluids, the fluid is sent to the intestines and then to your vein system. The venous system flows the fluid and the substances to the kidneys. The kidneys then filter the fluid and they process all your fluids and your substances. They each have a tube called a ureter that drains the fluid from the kidneys to the bladder. The bladder holds your urine and has a tube called the urethra that lets your urine exit your body into the toilet. Next is urinary frequency. This can also be a sign of a UTI. How often you urinate varies depending on how much water or how much liquids you're drinking, as well as other factors such as your bladder volume and the health of the surrounding muscles that hold up your bladder. If you notice that you're having to go to the restroom to urinate more often than usual, this can be a sign of bladder irritation and possibly a UTI. This shouldn't stop you from drinking lots of water. Even though drinking lots of water is going to make you urinate more often, this is helpful to flush out any of that bacteria that's trying to grow and establish an infection in your bladder. The next sign is called urinary urgency. This is where you feel a sudden urge or feeling that you need to urinate. This is another sign of bladder inflammation or irritation. Another sign is lower abdominal pain or pain over your bladder. This is a sign you might have a UTI. This sign is the least consistent among people that have UTIs, meaning many people with an infection don't have this symptom. But if you have other symptoms such as new pain with urination, plus this lower abdominal pain, it's wise to go see your doctor and talk about an antibiotic. The fifth sign is changes to your urine. When you're healthy, your urine should be light yellow or clear with not much odor at all. If you notice your urine is cloudy or darker or even bloody, definitely drink more water and give your doctor a call. Bloody or orange urine can be pretty serious, as it can be a sign of bladder cancer. You should always take that seriously and ask your doctor to take a urine sample. The last sign is one that most people don't think of when they think of UTIs, but it can be a sign of a more serious form of a UTI. This sign is back pain. Your kidneys are located towards the back and on each side of your body called flanks. Specific pain over what we call the flank can be a sign of a serious kidney infection called pyelonephritis. This big medical word is the word for a UTI that has become more complicated and spread upwards to someone's kidneys. If you break the word down, pyelo means pelvis, and that's the place where the infection started. Neph means kidney, and itis means inflammation. So putting it all together, the word is an infection from the pelvis traveling up to the kidneys, causing inflammation and an infection there at the kidneys. A major sign of this is flank or back pain. So the person might also have fevers and fatigue and feel pretty crummy, and those are signs of a widespread infection. So if you have any of these 6 signs, burning pain when urinating, frequency, urgency, lower abdominal pain, changes in your urine, or new mid-back pain, it might be time to call your doctor and to start an antibiotic. I love talking to people about their health. As I'm just getting started making these videos, let me know in the comments below what health question you have, and I might make a video answering your question. Always feel free to like and subscribe. Thanks!